This presentation is on os trigonum. An os trigonum is an accessory bone that develops behind the talus. This bone can be connected by fibrous bands. This can be in one or both feet and is usually congenital and develops between the ages of 8 to 11. This accessory bone can fuse to the posterior aspect of the talus and be referred to as a fused os trigonum or a triangular process. If this bone does not attach, it is referred to as an os trigonum. The prevalence is 1 to 25% of the people are born with this and is one of the most common accessory bones. This is usually asymptomatic. However, if fractured, due to the mechanism of forced hyperplanar flexion, can become very painful and self-limiting. There are two types of treatments for people who have symptomatic os trigonum: the conservative treatment or the surgical approach. As you can see here is a picture of the pinching sensation that you can experience with the os trigonum and the x-ray of an os trigonum. Conservative treatment involves immobilization for a period of time, activity modification, taping to prevent plantar flexion, cortisone injection for pain, and rehab. The surgical approach is used for highly symptomatic patients or if the os trigonum is fractured. The surgical approach involves removal of the accessory bone completely. So the clinical question was, in professional athletes, patients who have os trigonum, is the conservative or surgical approach more effective in having patients return to their career quicker and asymptomatic? Since this is one of the most common accessory bones, what makes this case so special? This bone is located on the posterior lateral process of the talus and can be misdiagnosed very easily. Many individuals have an os trigonum and don't even know it. When radiographing the ankle, this accessory bone can be confused as a fracture to the posterior aspect of the talus. A CT scan is the imaging of choice for a suspected fracture of the posterior talus structures. This will help identify if the os trigonum is present or if there's a posterior aspect of the talus fractured. The CT scan can also identify if the os trigonum has no pathology or contains a fracture. So now, can you identify between these two photos which one's a posterior talus fracture and which one's the os trigonum? So the first photo is the posterior talus fracture, and the second one is the os trigonum. The patient presented on the sideline after experiencing ankle sprain type of mechanism during practice. The patient was a 25-year-old male football player who reported pushing off on his right ankle and feeling instant pain. The patient was unable to walk after the injury, resulting in the ATs coming out to him. There is tenderness to palpate the posterior aspect of the ankle, posterior lateral to malleolus, and pain with passive and active plantar flexion. This patient's x-rays showed the presence of an os trigonum or fractured fragment of the posterior aspect of the talus. So from there, they decided a CT scan needed to be taken. And this showed that there's an os trigonum present as well as a fracture to it, which was not identified on the radiograph. You can see on the radiograph right here, that segment, unsure if it could be an os trigonum or posterior talar fracture, but then over here on the CT scan, you can notice this distinct line in the os trigonum. The question was if the patient could complete conservative treatment or if he needed surgery. This patient did not want to have surgery. However, due to the short time period the patient had off between minicamp and training camp limited the patient's treatment options. The patient did not want to have surgery because he was a rookie and he was trying to make the team. He knew surgery would set him behind and limit him in practice. This patient's goals was to play pro football and did not have a backup plan. The patient went to various doctors for evaluations. The team doc and other physicians reported it would be best if the patient received surgery due to the short time frame. This would have him back within 5 weeks as compared to conservative treatment that could fail and take longer. This 5-week rehab program would allow the patient to participate in training camp. However, he would miss minicamp in June. After 5 weeks, the patient would also not be fully back to his 100% for training camp. However, he would still be able to participate in training camp as compared to if he did nothing. So his end goal was to play for the New York Giants. So this was the external factors. Due to the patient receiving the surgery after a week of the injury, he did not have any strength deficits. Once the surgery was completed, the patient would have no restrictions. The patient would require to follow an appropriate return to play program as demonstrated in the chart above. Obviously, this isn't everything that the patient completed, but this is just a general time frame of when things were implemented and what the goals were within the 5-week period. Patients with an os trigonum are usually asymptomatic unless it becomes fractured. When fractured, pain can be noted with plantar flexion and pushing off due to the posterior process of the talus getting pinched. The uniqueness of this case revolves around diagnosing this individual. Radiographs can be misleading, secondary to questioning a fracture to the posterior talus or an os trigonum present. If the os trigonum is fractured, this can be missed on a radiograph, requiring a CT scan to identify if the os trigonum is fractured or contains no pathology. Once the bone is surgically removed, there is a low likelihood that the bone will regrow and cause more problems. Removal of the bone eliminates pain as compared to treating the patient's symptoms with a conservative approach. The surgical approach can decrease the amount of time that the patient is out of the game. Overall, due to the physicians being able to identify the fractured os trigonum appropriately through the CT scan, removal of symptomatic os trigonum is a quick and safe approach in getting the athlete back as soon as possible with a high success rate. The conservative treatment option can be done for athletes who don't want surgery and does not have a time restraint to start playing their sport again. And these are my references. Thank you.